Hi, everyone. Good afternoon. Thank you for joining us for our update. Since I've seen you last, we had a big snowstorm, so I hope everyone made it through that. And I want to thank our fantastic Ulster County DPW team that was out through that storm, working really 36, 48 hours straight. County roads were in great shape, and I know that is not by accident. So thanks to Tom Jackson and Brendan and the whole team for your work on that. We appreciate it. Diving into our COVID update here and heading into the beginning of another holiday period, we'll be pretty brief. I have some encouraging updates that we'll talk about in a minute, but really, to be honest, to start the brief, have to share some, pretty hard to hear numbers in terms of the impacts now on Ulster County with COVID-19. So in the month of December, remember, it's only December 22nd. We're really only 3 weeks into the month. We have already lost 30 Ulster County residents just this month of December in 22 days to COVID-19, making this, and in this last week alone, we've had 19 fatalities, making this clearly one of the deadliest and of course the most tragic and heartbreaking weeks that we've had in this entire pandemic. So I share that only to say that this is serious, that this is deadly for a significant number of people and absolutely devastating to families and loved ones across our county. So when we talk about the importance of being careful and those precautions, that is why we're talking about it, because a lot of these fatalities we believe are linked back ultimately to gatherings that happened around Thanksgiving. And as we head into another period of holidays where understandably people want to get together, I just ask that everyone keep that in mind, that those decisions do have consequences, and that in some cases those consequences mean lives of loved ones, especially vulnerable members of our community and seniors. And we are so close to being able to get vaccines to those folks that it makes it even more tragic that we're losing people now when we are so close to having that widespread availability of the vaccine. So as we head into this holiday period and the winter period, I really urge and plead with each of you to continue to take this seriously and think about your loved ones as well. In terms of the total numbers, we have now far surpassed 5,000 cumulative cases. We're at 5,294 since the beginning of the pandemic in the county. If you remember about a month ago when I talked about the projections, we said that in a worst case scenario, we would be at 5,000 by Christmas, and we're now well past that, and we're before Christmas. So we see further evidence and data that the COVID pandemic in the second wave is definitively much worse, and of course we're seeing the consequences of that on multiple fronts. We are still working and have continued to make progress on our testing capacity. We've now tested 185,626 residents, 3,111 recovered, but that fatality number, we now stand at 131 fatalities. And when I went back and looked, and on December 1st, that we were at 101, and that was just really a very stark and really just sad moment of reflection of looking at how difficult this last month has been in particular. Hospitalization, some good news here. We're holding steady and actually slightly down on our hospitalization numbers in the county. We're at 21 hospitalized in Ulster County and 2 in the ICU. We were at 24, I believe, or a little bit higher in our last update. So you can see on the graph as well that slightly ticked down, and I hope that we can continue to see that trend go down. The active case numbers, also a little bit of possible sign of optimism here. We are starting to see a little bit of a flattening in the total active case count. We're hovering right around that 2,000 number. Right now we're at 2,052. But as we see more and more people recovering and fighting through this, we've been able to sort of recover people at about the same rate that we're seeing new positives, which is, at least for the last few days, held us steady at around 2,000 total active cases. If we can start to get that number down, of course, that's really the only way out of the worst case statistics in terms of fatalities and hospitalizations, is to bring that total active case count down. New infection rates in the county, this is held about steady as well. In the last 96 hours since our last update, we have tested just over 6,000. We've tested 6,004 residents and had 312 positive of that 6,000. So for the 96-hour period, we're at a 5.2% new infection rate. In the last 24 hours, we're just above that at 6.46%. Again, for context, it's important to remember that throughout the late spring and summer and much of the fall, we were under 1%, which was a much more manageable rate, and our goal was to stay under there, which we did for quite a while. But of course, we're way above that now, and that's when we start to really see the fatalities climb as we see the total cases climb. And as we'd expect, there's a 2 to 4 week lag period there. Which is why, again, going into the Christmas holidays and New Year's holiday, the last thing we can afford is to see another big spike in cases, because that would then mean heading into January and into February, we would see those hospitalization numbers up, we'd see the fatalities up, and that is what I know we all really desperately want to avoid and are working to avoid. In terms of our projections for cumulative cases looking out, you can see that here. Depending on what we do, each of us, in the next days and weeks, and especially around the holidays with social gatherings, we could start to level this off and flatten that curve, or we could be upwards of 8,000 cases come the new year, which is, of course, not where we want to be. Hospital capacity, thanks to our hospital partners, we're in good shape here. While we have 21 hospitalized and 2 in ICUs, we have more than sufficient need for the near term. And if you'll remember, in terms of the new metrics that the governor and New York State has put in place, most of the restrictions and closures are tied to our hospital capacity. So as long as our hospital capacity numbers remain around where they are, where at this point we're not at risk of getting near those numbers, we would likely remain where we are in terms of restrictions. But regardless of those restrictions from the state, I think we can all agree that even one more fatality from COVID-19 is unacceptable, and that we all have to, regardless of things that are directed from the top down, it's on us individually to do the right thing in terms of masks and distancing and hand washing and avoiding gatherings, so that we can all take care of each other and get through this winter together and come out the other side to the vaccines. Speaking of vaccines, what are we doing on that front going forward? This is where we do have great reason to have hope and optimism and some light at the end of what will admittedly be still a long tunnel through the winter months. So here's what's been happening in Ulster County. Remember the vaccine rollout schedule. It has started here. We are now into phase 1 in New York State. There are 5 phases of the state's vaccine distribution plan. We are still in phase 1, which is focused on our healthcare workers, our long-term care facilities, and especially our senior care, and the most at-risk long-term care facility patients. That work in phase 1 will continue through the month of December and into the month of January. We've had some really significant moments in this regard here in Ulster County. Last week on Friday, I had the opportunity and really the privilege to go and get to watch some of our ER nurses and health professionals who have been since March of this year risking their lives every single day, putting others ahead of themselves. I had the chance to see some of them be vaccinated as part of this first phase, and that was a really really a powerful moment, and I think we'll all look back and see this as the beginning of the end. This will be a long period of vaccination work, but actually wanted to share one of the photos from one of our great ER nurses who was actually on her way to another shift in the ER at Health Alliance in the Broadway building, and she was very, I think, overwhelmed by the fact that her and her colleagues who had been putting in this work were some of the first in the state and in the country to receive this vaccine. And it was definitely a small moment of some, again, light and celebration. The other thing that actually has started and is happening today in Ulster County, it was the first day for our senior facilities, our skilled nursing and assisted living senior facilities. The first doses of those are occurring right now. The first one to receive that is the Golden Hill Senior Facility here in Kingston. That's happening today, and in the next month to 6 weeks, all of our senior facilities, both residents and staff, will be getting those through a series of first shots and second shots, and then making sure that they all get those. In terms of our healthcare workers, Health Alliance has had about 100 to 120 of their most at-risk healthcare workers so far receive the vaccine in the last week, and at Ellenville Regional we've had about 50 so far. Those numbers will continue to grow, especially now as we're receiving also the first doses of the Moderna vaccine starting here in the next few days. Another significant development on the vaccine distribution efforts, and an important one, starting on Monday, December 28th, our EMS workers, our EMTs, ambulance drivers, and others that are also putting themselves at risk will join the other phase 1 healthcare workers and really heroes that have been at greatest risk. They will start to receive these vaccines as well, either at Health Alliance in Kingston or at Ellenville Regional. So we've been fighting and working with our EMTs to make sure they are also first in line to get the vaccine, and I'm proud that that'll start on Monday, December 28th. So that is good news, and looking forward into January, that's where we'll move to phase 2, continue to see first responders, teachers and school staff, public health workers, other essential frontline workers, from grocery store workers to transit to mail carriers, all the folks that we thank every single day. Another way that we'll thank you is that you will have the first chance, rightly, to receive the vaccine, and then we'll, of course, progress from there. So as we move forward with the vaccine distribution, we will continue to keep you updated. We don't always have exact dates because it's somewhat dependent on how quickly the different companies can produce the various vaccines. But rest assured that we will be communicating with you, especially as we get into phase 2 and 3, 4, 5, where we have a monumental task of making sure that every single resident of the county who wants to be vaccinated will be able to do so quickly, safely, and equitably. And that is something that I will not sleep until we make sure happens, with the help of our great vaccine distribution coalition, which continues to grow by the day. So that's what we're looking forward to. But we have more work to do to get there, and I want to make sure that all of our loved ones are going to make it through this winter so that they can get this vaccine, and I just think that is what we all need to keep top of mind heading into the holidays. The other thing that we're doing in terms of taking care of folks through this, in addition to the health aspects, we of course know that the pressure has continued to build on everyone in the county and all of our residents due to now the prolonged economic impacts of COVID, due to all the effects of being potentially out of work or less work, of schools being interrupted and childcare challenges, of seniors being homebound, of small business owners struggling to keep their doors open or even having to close. And so if you remember back to the beginning of the pandemic and in the worst of it in the spring, we stood up something that I'm very proud of, our Project Resilience effort, which was really created on the fly as a way to get the whole community rallied to take care of each other, that those that could afford to help a little bit, whether that was delivering a meal and volunteering or offering a few dollars, that we were going to step up and take care of those that needed help at that moment, that were vulnerable. Clearly, heading into the winter, we have a lot of people who are going to need our help again. And so I wish we didn't have to do this, of course, but I'm proud that in this moment we are going to really reactivate and move to a new phase of Project Resilience in Ulster County to make sure that we are meeting those needs heading into this winter, which we know will be tough. Based on what we learned in the first phase, we'll be adjusting and learning as we go, and we really have three main areas of great need broadly, and groups of people who we know are particularly vulnerable and challenged. So our seniors continue to have great need and often be most vulnerable and also often stuck at home and disconnected. So I'll talk in a minute about how Project Resilience will be supporting our seniors. Our young people, our youth and our children have had so many challenges between school and other pressures. So we're also going to make sure we have funding and programs through Resilience to support our kids and our youth. And then finally, as we've known from the beginning, we have thousands of families, even before COVID, that were living paycheck to paycheck, and now that number has grown exponentially. While the federal relief that we did see passed yesterday will help somewhat, it's not going to be enough, and we know that, and so we're going to do everything we can at our level to step up support there in getting more dollars into the hands of those families so that they can pay rent, put food on the table, and just get through this winter. So the first announcement that we have as part of this next phase of resilience is focused on that first group of seniors in our community who we know are at risk. Yesterday, it was a great way to start the week. Yesterday, early morning, I went over to our partners at Gateway, who have been working throughout this pandemic to deliver delicious meals to our homebound seniors through our Meals on Wheels program. Because of the needs of the pandemic, we've seen a wait list start to grow of seniors who need meals but weren't able to get them before. So we're using some of our resilience funds to make sure that everybody on that wait list is able to be served and get meals delivered to them through that program. With this investment from Project Resilience, through the winter, we'll now be able to deliver and serve an additional 17,000 meals to several hundred seniors across Ulster County over the winter, over the next 12 plus weeks, to make sure that they are safe and cared for and not hungry, and that they just know that someone cares about them and is willing to drive through the snow and whatever else to bring them a meal. And when I talked yesterday with some of the staff at Gateway, who last week were literally driving through a foot plus of snow to bring these meals to seniors, they were just telling me some of the stories of how much that meant to those on the other end that were getting those meals. And that is another sign of positivity and hope in the midst of this challenge. So as we come into the weeks ahead and into the holidays with Project Resilience, we're going to be doing more of this work thanks to the generosity of many in our community. For this next phase, we have already raised about $900,000 that we'll be putting to work in the winter. That's additional money from the last round that we're able to pull together, thanks to many stepping up with small and large support already. But we are also going to relaunch our crowdfunding page in partnership with United Way of Ulster County, who helped us so much in the first round of Resilience, Stacy and team. We're going to have that. We have that web page up again, the Project Resilience page. As you get towards the end of the year and into the holidays, if you are fortunate enough to have any funds that you can spare and you want to put them to work helping our seniors and our young people and our struggling families in the county, this is one of many, but a great way to get that funding out at this critical time. You can go on that page. I just checked before this. We've had some really nice support already, even before we made public that the page was up. So that is very cool and much appreciated. You can get to that link through our county page. You can also get to it through the United Way page. But again, if you Google Ulster County Project Resilience and search that, any support that you can provide will really go a very long way to help people that are under immense pressure and have immense need right now. So one of the things I know we'll look back on coming out of this crisis is the generosity and the compassion and really the ingenuity and the creativity of our community coming together to get each other through this. Let's keep that up heading into the holidays here. As we wrap up today's update, I want to especially thank a group of our healthcare workers. We'll put up the whole list, although it's not even an exhaustive list of all that we want to thank. But I especially today, as we start our vaccinations in our senior facilities, we have 13 senior and assisted living facilities in the county, and hundreds of workers that throughout this year have gone above and beyond, risking their lives and their families' lives to protect and try to keep our most vulnerable, including my own grandmother, healthy and safe through this. And I just want to thank all of those workers who, frankly, don't get paid nearly enough for the heroic work that they do. And I especially want to thank the great team at Mountain Valley Manor. They've done a particularly great job, and I know for my family and I that's meant an awful lot. So we appreciate you, and we're looking forward to you all being on that list for vaccinations, and ultimately all of us coming into next year being able to see our loved ones again that we haven't seen in far too long. So thank you to all of you for that work and the continued work. If you need anything at any point, you can always call our Recovery Service Center. Questions about COVID and testing and vaccinations, or questions about food or other critical programs, you can call us at the RSC. The number is 845-443-8888, and we're standing by for that. In terms of our next update, we are, given where COVID is, I'm going to make sure that we continue to keep you all updated even through the holiday period. So our next update will be, I know, on Christmas Eve for those that celebrate, but we will be doing our next update on Thursday at 2 p.m., and I will continue them the week after between Christmas and New Year's as well, although I might be doing it from home, but we will always be keeping you updated and making sure that you have the latest information that we have. I appreciate everybody hanging in through these really extraordinary and difficult times. And now we know that we're almost there, and I'm confident that if we stick together and take care of each other, we can get through this. So stay healthy and safe and be resilient, and we will see you on Thursday.